Upon completing this in-service, you will, number 1, understand the definition of dysphagia, number 2, know the signs and symptoms of dysphagia, and number 3, understand the IDDSI Framework Descriptors and the comparisons between the National Dysphagia Diet. Dysphagia means difficulty in swallowing. Swallowing is the movement of food, liquid, secretions, or saliva, or medications from the mouth to the stomach. Anyone with dysphagia can be at risk for malnutrition and/or dehydration if they are not able to eat or drink. People with dysphagia may require texture modifications that make food and/or liquids easier to swallow. Signs and symptoms of risk for dysphagia. Notify the dietitian, speech therapist, or other interdisciplinary team members if you see anyone with one or more of these signs or symptoms. Poorly fitting dentures, missing dentures or poor teeth or few teeth, slow eating process or poor appetite with little food intake, avoids or doesn't eat specific foods such as meat, bread, fresh fruits, vegetables, reported or complaint of swallowing or chewing difficulty. Notify the dietitian, speech therapist, or other team member if you see anyone with one or more of these signs or symptoms. Coughing after swallowing, choking incidents or complaint of food stuck in throat, pocketing food in the mouth or spitting food out of the mouth, poor tongue control, tongue thrusts, need for multiple swallows, drooling, or eating resistance such as pushing food away or clenching teeth. International Dysphagia Diet. Use your facility or company policy on which dysphagia diet standard to use. The International Dysphagia Diet Standardization Initiative, or IDDSI, is a new dysphagia diet standard that started in 2013. The IDDSI is a dysphagia diet standard that is intended to meet the needs of individuals with dysphagia across the age span, across all care settings, and across all cultures. The IDDSI dysphagia diet standard is called the International Dysphagia Diet Framework. The IDDSI framework consists of a continuum of 8 levels, from 0 to 7. Levels are identified by text labels, numbers, and color codes to improve safety and identification. The American Academy of Nutrition and Dietetics, or AND, and the American Speech Language Hearing Association support the implementation of IDDSI framework and definitions. Many food companies are transitioning to IDDSI coding on their food labels. All 8 levels are shown here. Drinks, with the pyramid going from 0 to 4, and foods going from 3 to 7. You can see in the bottom, 0 is thin, 1 is slightly thick, 2 is mildly thick, 3 moderately thick, and 4 extremely thick. And on the food side, 3 is liquidized, 4 puree, 5 minced and moist, 6 soft and bite-sized, and then under 7 is easy to chew and regular. The IDDSI Framework Descriptors by level number, color code, name, and definition. 0 or white, thin, applies to drinks, fluids, flows like water, fast flow, can drink through any type of cup or straw. Level 1 or gray, slightly thick, applies to drinks and fluids, thicker than water, requires a little more effort to drink than thin liquids, flows through straw. Example would be infant formula or nutritional supplements. Level 2, or pink, mildly thick, applies to drinks and fluids, flows off a spoon, is sippable, pours quickly from a spoon but slower than thin liquids. Effort is required to drink this thickness through standard straw. Level 3, or yellow, liquidized, moderately thick, applies to food, drinks, fluids, can be drunk from a cup. Some effort is required to suck through a standard bore or wide bore straw. Cannot be piped, layered, or molded on a plate. Cannot be eaten with a fork because it drips slowly in dollops through the prongs. Can be eaten with a spoon. No oral processing or chewing required, can be swallowed directly. Smooth texture with no bits, lumps, fibers, bits of shell, or skin, husk, particles of gristle or bone. Level 4, or green, is puree, extremely thick, applies to food, drinks, and fluids. Usually eaten with a spoon. A fork is possible. cannot be drunk from a cup, cannot be sucked through a straw, does not require chewing, can be piped, layered, or molded, shows some very slow movement but cannot be poured, falls off the spoon in a single spoonful when tilted and continues to hold its shape on a plate, and there are no lumps. Level 5 is orange, minced and moist, and applies to food, can be eaten with a fork or spoon, could be eaten with chopsticks in some cases, soft and moist with no separate thin liquids, small lumps visible within the food. Adults, the size would be 4 millimeter as far as lump size, and lumps are easy to squish with the tongue. Level 6 is blue, soft or bite-sized, applies to food, can be eaten with a fork, spoon, or chopsticks, can be mashed or broken down with pressure from fork, spoon, or chopsticks. A knife is not required to cut this food, but may be used to help loading a fork or spoon. Chewing is required before swallowing. Soft, tender, and moist throughout, but with no separate thin liquids. Bite-sized pieces are appropriate for size and oral processing skills. In the adult, the size would be 15 millimeters or 1.5 centimeter pieces. Level 7 or black, easy to chew, regular, applies to food. Normal everyday foods of various textures that are developmentally and age appropriate. Any method may be used to eat these foods. Foods may be hard and crunchy or naturally soft. Bite size is not restricted at level 7. Adults, smaller or greater than 15 millimeters or 1.5 centimeter pieces. Includes hard, tough, chewy, fibrous, stringy, dry, crispy, crunchy, or crumbly bits. Includes foods that contain pips, seeds, pith inside skin, husk, or bones. Includes dual consistency or mixed consistency foods and liquids. Here's a table comparing the National Dysphagia Diet and IDDSI. On the left-hand side, you'll see the National Dysphagia Diet terminology, and on the right-hand side, IDDSI terminology. So on the left side, regular would continue to be called regular with the IDDSI terminology. Dysphagia advanced would be soft or bite-sized or level 6, blue. Dysphagia mechanical altered would be level 5, orange, minced and moist. Dysphagia puree would be level 4 and level 3, green and yellow. Pureed, extremely thick, and liquidized, moderately thick. Spoon-thick liquids would be green or pureed, extremely thick. Honey-thick liquids would be level 3, yellow, liquidized, moderately thick. Nectar-thick would be level 2, pink, mildly thick. Naturally thick liquids like supplements would be level 1, gray, slightly thick. And thin would be level 0, white or thin. Let's test your knowledge of the International Dysphagia Diet Standardization Initiative, or IDDSI. Dysphagia is A, difficulty breathing, B, difficulty cutting food, C, difficulty sitting in a chair, or D, difficulty swallowing. And the answer to question number 1, dysphagia, is D, difficulty swallowing. Question number 2, what is a sign or symptom that someone may be at risk for dysphagia? A, weight gain, B, coughing after swallowing, C, skin breakdown, or D, none of the above. And the answer to question number 2, what is a sign or symptom that someone may be at risk for dysphagia? B, coughing after swallowing. Question number 3. A descriptor of 2, pink, mildly thick, indicates food or liquids A, flow off a spoon, B, sippable, pours quickly from a spoon but slower than thin drinks, C, effort is required to drink this thickness through standard straw, or D, all of the above? And the answer to question number 3 is D, all of the above. Question number 4, true or false? The IDDSI diet consists of 7 texture modification standards. And the answer to question number 4 is false. As you remember, there are 8 levels, 0 to 7. Question number 5, true or false? A honey-thick liquid diet is considered a 3 yellow liquidized moderately thick diet under IDDSI terminology. And the answer to question number 5 is true. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or consulting dietitian services, please contact us at 1-800-761-9200 or nutritioncaresystems.com.